and spirituality. All right, so some definitions that we need to go over. Culture is defined by the Halter textbook as shared beliefs, values, and practices that guide a group's thoughts and actions. Spirituality, on the other hand, doesn't have a clear definition. The Giddens textbook has a good definition, but I like the one by Borna et al. Better, and it defines it as spirituality as a dynamic aspect of humanity to which humans seek purpose, meaning, and transcendence. And so, with that being said, it's unique to each person. All right, so conflicts that we might have with mental illness in culture. Some cultures might have a stigma against them, and in light of, they might try to conceal people's mental illnesses by putting them away in asylums. Another thing, cultures believe that people with mental illness have special powers or might have evil spirits. And then we also can see patients presenting with physical signs of illness, but all medical reasons are ruled out. So, with that being said, patients might not live a normal life. They might be more prone to other comorbidities and complications since they don't seek treatment. And the patient is diagnosed with a mental illness after all other causes are ruled out. And so, with that being said, they are showing patient somatization. All right, the nursing process. So the assessment that we're going to be doing in our scenario later on in the video, we're going to assess the influence of culture and spirituality on illness. And so the FICA assessment tool, as well as cultural formulation interview. And the Halter textbook, it describes that formulation interview as a 14-question assessment, and it gives clinicians baseline idea of patients' values and assumptions based upon their culture and allows them to plan their care accordingly. The assessment also considers the meaning of the illness, how the family, their role or their support, as well as possible expectations of care. And so we need to identify which family members the patient has for moral support. We need to see if there are any cultural considerations for communication, nonverbal and verbal, whether that's eye contact or family members answering for the patient. And then we also need to assess the gait and movements for psychomotor retardation. And then we need to assess the risk for suicide, especially for someone who has somatization, but they have a psychological disability. There's the FICA tool. Shelby's going to be using that in the video. All right, so nursing diagnosis. It is defined by authors Robinson et al. We need to define somatization, and to them they describe it as a range of behaviors, both body expressions and language, that convey personal feelings of distress that present as physiological changes. So some diagnoses can be used for Mrs. Wong, who is our patient in our scenario. Is going to be ineffective coping related to the lack of insight into underlying conflicts, impaired verbal communication related to cultural differences, as well as impaired individual resilience related to possible psychological disorders. And this is basically in light of her culture not believing in depression, and so she doesn't have coping mechanisms or she doesn't have insight on what depression is. All right, so in our planning, we're going to be planning for the outcome of Miss Wong being able to use effective coping strategies and recognize and report triggers for depression. And we need to identify the patient's personal goals and current coping strategies. And so there is an article that discusses coping strategies, especially in light of spiritual beliefs, because it describes spiritual beliefs as giving patients a sense of hope and stability in a situation of uncertainty. So they cope by going to their spiritual traditions. We also need to maintain safety and assess the risk for suicide. We always know safety is number one. And then we need to have interprofessional collaboration, mainly for pharmacotherapy that can coincide with their beliefs, as well as education that they are able to understand. All right, so some interventions. We have therapeutic communication, referrals to support groups, especially for those with cultures who don't believe in depression, more support groups that are guided towards their beliefs and how they can educate them on depression. We need to increase the family's understanding and acceptance of depression within their culture, like I kind of mentioned before. And we need to provide opportunities for the patient to discuss the meaning of the situation. So that's nurses offering themselves to the patient to be able to discuss whatever they have on their minds. All right, and then evaluation. Patients, families provide support for patients' depression. So they have family support. We need to have the patient be able to identify their triggers and use the given coping strategies. And then we need the patient to verbalize that they accept their family to assist them with activities of daily living if they are physically disabled. All right, so big discussion question. What's the importance of a spiritual assessment? Well, we live in a melting pot society where there are so many different cultures and so many different spiritual beliefs. And as nurses, we need to have cultural competence to be able to abide by those beliefs and care for them accordingly. And There is an article that was describing how spiritual beliefs impact on psychological well-being and the ability to cope, and it gives them ways to cope, as well as they can go into prayer and meditation to help them with their well-being and their abilities to cope. And that article is referenced at the end. And then we also have spiritual beliefs determining our methods of treatment. An example of that is Jehovah's Witness. They don't believe in blood transfusions, so nurses and doctors have to work together to find other treatments that can coincide with those beliefs. This is a little practice, little test question, and you can pause it to be able to read it and see, but we have our correct answers. Well, I should just say the question. Our interventions that would be appropriate for a nurse to perform for a patient experiencing somatization secondary to depression. So, providing resources, cognitive behavioral therapy, giving informational pamphlets, teaching different coping mechanisms, as well as offering of self. So, A, C, D, and E are all correct answers. Now, B is also correct, but that is outside of the scope of practice for nurses. All right, so a scenario in our video, we have Miss Lee Wong. She's a 48-year-old female of Asian descent, presenting to the primary care provider with general body aches and pain, fatigue, hypersomnia, weight loss, and the lack of interest in activities that were once enjoyable for the past few months. Her husband's present, and he answers a lot of the questions. She also states she's very concerned with her lack of involvement in her community as she is very tired. All right.
Mrs. Wong, we'll take you back now. Hello, Mrs. Wong. I'm Shelby. I'm going to be your nurse today. You are Mr. Wong?
Yes.
What brings you guys in today?
Well, she's been having some back pain and she hadn't really
Broad openings and giving recognition were being used.
been able to sleep.
Okay. How long has that been going on for?
I would say it started a couple weeks ago.
Okay, so Mrs. Wong, you haven't been sleeping for about 3 or 4 weeks now? Okay. Miss Wong, can you tell me more about your back pain? It just hurts all over?
Restating.
Okay. We're going to run some tests. We're going to take some x-rays and take some blood work from you. Is that okay? Okay, do you have any questions for me right now? Okay. We'll head over there. So all of your blood work, all the x-rays look completely normal. I notice you're not making eye contact. Is there any spiritual or cultural needs I need to know about?
We practice Eastern tradition.
Okay. I'm going to actually do an assessment. It's called the FICA Tool for Spiritual Assessment. We're going to start with faith or beliefs. What are your spiritual beliefs? I know you said you practice Eastern culture. Okay. Do you guys consider yourself as spiritual people?
Yes.
Okay. Okay, we're going to talk about the importance and influence. Is faith and spirituality important to you?
Very.
Okay, so you guys are very into your spirituality. Okay. Mrs. Wong, how has your illness affected your personal practices or beliefs?
I just don't feel like doing anything anymore.
You just don't feel like practicing your normal beliefs?
I can't remember the last time I attended mosque service.
Okay.
What am I attending?
All right. We're going to talk about community. Are you connected with a faith center in the community right now?
Well, we were, but we haven't been since it's all happened.
So you haven't been to the faith community center because of Mrs. Wong's back pain and insomnia?
Right.
Okay. Does that faith center provide support and comfort for you?
She just doesn't reach out to them. They would, but she just can't get out of the house.
Okay. All right. Is there a person or group leader that provides support or assistance to you guys in your spirituality?
We have a spiritual leader.
Okay. All right. And what can I do for you guys right now? What support or guidance can I provide to you to support your spiritual beliefs and practices?
Well, I mean, we could call our spiritual leader to come out and meditate with us.
Okay. I think that sounds like a good idea. I'm going to go discuss the results with the doctor, and I'm going to be back in here in a couple minutes, okay?
Okay.
All right. Thank you.
Hi, Dr. Bain. I went and assessed Mrs. Wong in exam room 2, and I did all the diagnostic testing and the blood work you asked me to do, and everything came back normal. We discussed her spirituality, and I did the FICA tool for spiritual assessment, and I really believe that her pain, her back pain, and her insomnia is coming from a mental issue more than a physical issue.
Okay, so it sounds like she may have depression. So she may be having somatization. So what we need to do is we need to refer her to family and individual therapy. And we need to give her some information about support groups that will fit with her culture and spirituality. And then we also need to make sure that the family is understanding and accepting because of their culture. It may be different than ours.
All right, well, I'll go meet back with them and give them information.
Okay,
Thank you so much.
I've discussed the results of your test and assessment of cultural beliefs with Dr. Bain, and we believe you may be experiencing signs and symptoms of depression, which is manifesting as your back pain and insomnia. So I'm going to provide you both with information about what depression is.
She's giving information.
That to you. Okay. That will help you better understand what depression is. I'm also going to give you a referral to a therapist that has knowledge about your culture and beliefs. So, but until your appointment, I want you to do some relaxation techniques such as deep breathing and journaling that you can do at home. Is there anything else I can do for you guys right now?
I think that covers it.
Alright. Well, thank you so much for coming in today, and I hope you get to feeling better, okay?
All right. So here are our references. And if you guys have any questions, just please let us know and we'll be able to show you guys that on Friday. Thank you for listening.